right, everybody. Thank you, Brian. And I would like to welcome Dr. Vasquez to the stage. Dr. Vasquez is one of our primary care physicians at the new Walk-In Center at Harbor Point, and he will be speaking a little bit about the importance of primary care. We have a couple folks from our team today who would like to show the proper readings for a blood pressure screening. And I will let Dr. Vasquez tell a little bit more about himself, but I will let him take you forward. So thank you, Dr. Vasquez.
Oh, thank you, Jay. Hi, everybody. Yes, so I'm Romulo Vasquez. I've been here with Stamford Health since May 29. And I figure I took this opportunity to join this wonderful new community. Before coming here, I was working in the town of Fairfield. I mainly did sports medicine and orthopedics, but I have always done urgent care since after graduation from my residency program. So I did my training in family medicine in New York City, Jamaica Hospital, and then I did a fellowship in sports medicine in upstate New York, Binghamton area, Bristol, which was fascinating. And my undergraduate degree was in physical therapy, so that's why I'm so fascinated to meet my team here. So what I've noticed throughout my career and my years of experience is that many people don't really go to a doctor unless they have a problem. And this happens especially with young people, right? Yeah. Because usually young people, they are healthy and they usually don't have medical conditions. Unfortunately, as we age, we start having different medical conditions and musculoskeletal problems as well. And so I decided to come and give a quick talk why everybody needs a primary care doctor. So a primary care doctor will connect us between the medical process going on and the insurance company, because unfortunately, if you have an insurance, you will have to select your primary care doctor based on what the insurance is telling you. That's another discussion. But the primary care doctor can really direct you to the healthcare system. And then a primary care doctor can also emphasize on prevention. Prevention is the key for anything, even like for musculoskeletal problems, like our physical therapist team just mentioned. Always, good proper body mechanics, so on and so forth. Same thing in medicine. If we prevent a disease, we should live longer and healthier. The primary care doctor can also teach you ways on how to have healthy habits, and for the same reason, to prevent disease. And unfortunately, once we are sick, the primary care doctor can manage those chronic conditions. And some chronic conditions can really get out of the hands of the primary care doctor, at which point in time they will have to refer you to a specialist. So the primary care doctor can refer you to any specialist that the primary care doctor cannot deal with. For example, in dermatology, if I myself am not comfortable looking at a lesion, in the back of my head is always thinking about melanoma or some type of cancer. I will definitely not waste my time and send the patient to dermatology, because the sooner they diagnose you with a condition, the sooner they intervene, they do treatment, and you have more success of curing the disease. So those are the main reasons why everybody should have a primary care doctor. But then it's very important that when you select your primary care doctor, you need to be comfortable with your primary care doctor. If you really you're not comfortable with a primary care doctor, don't change your primary care doctor. But it's better to stick with the same primary care doctor. So choose the right one based on your personality, on your values, perhaps on your culture, because the relationship with the primary care doctor can be for many years. Like for example, my wife, she's been having the same primary care doctor for the past 20 years, which is fascinating. So the primary care doctor probably knows my wife better than me. It's true. So see, that's why you need to find the right primary care doctor. Yeah. Good. So anyway, so that's the reason why we choose the right primary care doctor and stick with the primary care doctor. And sometimes, sometimes you might be concentrating on something different. So your job as a patient is to always say, doctor, but what do you think? What if I have something else? Can you please send me to the specialist? And we will say, okay, yes, you're right, your concern is valid, and we'll send you there. But you need to also express your concern so we address it correctly. Good. So now I am going to introduce you our Harbor Point Urgent Care right here at the corner of Washington Boulevard and Atlantic Street. So this is an urgent care walking orthopedic center that was opened in July 1st. And let me tell you, we see every type of condition. Right now we are seeing people 14 years and older, but next year we will be seeing children and everybody of all ages. And we take care of colds, of COVID, flu, anything. If you need a vaccine, we take care of vaccine for anything, even rabies vaccine. So you just have to call us and we will get the rabies vaccine for you. Okay, and then God forbid you have, a fall, you fall down, we'll take care of you. We don't have x-rays right now, but we'll send you, we know where to send you to get x-rays, but we get the ball rolling. If you need to see a physical therapist, especially me, since my background is sports medicine, I will take care of you and refer you to physical therapy. You will do whatever you want in terms of physical therapy, you choose. And but the thing is that we do fast care. If I see you for say, let's say a skin lesion and I'm not sure what's going on, I will send you to the dermatologist. If you have an STD, just come and we'll take care of everything. So you just come. Okay. Testing, 1, 2, 3. Great, thank you. So yeah, that's much better because I was running out of voice. So as I was saying, just come to us. We are ready for you, and we will do the right thing, and we will expedite medical care. And sometimes, when you call your primary care doctor because you have an X concern or X disease, and your primary care doctor is not ready for you, just come to us and we'll take care of you. Okay? And we are open Monday through Sunday, 8 a.m. to 8 p.m. Okay? Yes, definitely. So we are available for you right there. Okay, so finally I would like to discuss about blood pressure. So most of us may know that we grew up with this notion that normal blood pressure is 120/80. And hypertension was defined anything above 140 systolic and diastolic more than 90. But then the guidelines recently changed in 2017 by the American College of Cardiology and the American Heart Association. Now they're more strict with these numbers. So now they define regular normal blood pressure less than 120 millimeters of mercury systolic and diastolic less than 80. And they consider elevated blood pressure already anywhere from more than one. I'm sorry. They define hypertension in 2 stages, stage 1 and stage 2. So now stage 1 is a little bit higher than what we used to do. So now stage 1, they go from systolic blood pressure anywhere from 130 to 129, which obviously is different than before, or diastolic blood pressure between 80 and 89. So that's significant. And then stage 2 hypertension is more than 140 millimeters of mercury for systolic blood pressure, and for diastolic more than 90. So they're more strict. And with this new criteria for the high blood pressure, about the prevalence of high blood pressure is about 47% in the US. So that's a significant number. Whereas when we were used to use the old guidelines, the prevalence was about 30. Okay, so now it's 47. And now, why are we concerned about hypertension? Is because many of you may know they call it the silent killer, because we never know when we're gonna get a stroke, a heart disease, or it can shut down your kidneys. So for those 3 main reasons, high blood pressure definitely will affect your heart, your kidneys, and it can give us a stroke. And so for that reason, we need to really be proactive and see a primary care doctor, because there's so many people walking around with high blood pressure they don't even know. Same thing, there's so many people with diabetes and they're walking around and they don't know. And we had this wonderful nutrition lecture earlier before, right? Everything is portion, and you have to look at what you're eating. Look at the carbohydrates. If you're diabetic, you have to really take a look at the carbohydrates. You don't want to be loading those carbohydrates because it will just, your diabetes will just get worse. And same thing with the sodium for the high blood pressure. Okay, so that was an excellent talk, by the way. Any questions or concerns?
So, the change in high blood pressure, the numbers, is just because we're seeing such a prevalence of disease related to slightly elevated. That's somebody had a high blood pressure, 35.
Yeah, well, the whole point is prevention, right? They want to catch it early and get you closer to the range, and so you can control it. And actually, you know, I mean, they can control it with, unfortunately, the different types of hypertensions, right? Some of them are genetics, and there's not much we can do about it. But then, if we get the proper medication on time, then we can prevent those three main organ diseases. Yeah.
No, I want to bring up like a very important tip. So I'm a pharmacist, so I'm in healthcare. The most important thing is to open your lines of communication. It's very important to communicate, because if the specialists don't know what's going on, and if the primary care doctor doesn't know what's going on with specialty, we're going to have some issues. So always get their business card, always save their contact information, and if there's a change in medication from a primary care doctor, let the specialist know, and vice versa, so we can prevent drug interactions.
True. And the same thing, let's say you go to a different healthcare group and then suddenly you get sick and you go to a different medical group or a different urgent care, and they have no connection with the medical system. So please always bring all your medications, or at least know in top of the head. Now, most of us are young here, right? Right? But usually, I get so frustrated when in the walk-in comes with, comes an elderly person, and they don't bring anything. And usually, again, as we age, we get diseases, right? And we are on different medications. Unfortunately, that's life. And so they don't bring anything. And I need to prescribe an antibiotic, and I'm not sure if that's going to interact adversely with the medications that they're taking. So it makes my job harder, because as a doctor, always do no harm, right? And so when you go to the doctor, always bring all your medications, or at least put in your notes in the phone, which is so fast now. But
Also,
thank you.
conditions. Also, the conditions as well.
Oh, yes, the diagnosis. You can bring all those, the list of diagnoses that you have.
In terms of prevention, in terms of like yearly colonoscopies, have the age ranges changed for when you should start getting yearly colonoscopies?
Now, to my knowledge, they still recommend a colonoscopy. If you have no risk factors, you start at 50. And of course, if there are risk factors, they start younger. Yeah, but colonoscopy is a big thing. And a lot of people don't really do it. And with all the respect, women are smarter than us men, because they are proactive. They go to a doctor more often. They get checked. They get everything done. Our guys, I mean, we neglect. There you go.
Yes. I do.
Really true. Well, the best thing would be to call the insurance company. Seriously, tell them, email me a list of all the primary care doctors in my zip code if you want to stay in your zip code. And then, quite honestly, nowadays with technology, just Google the doctor. Yeah, true. Just Google the doctor, check the reviews, see what people are saying. And again, my wife is one of the first ones that does that. She's always checking. Oh, there you go. True. Yeah, there you go. Good. Any other questions or concerns?
So it's like confirm also, even though it's on the website, confirm that they still accept it, just to be safe.
Oh, yeah, that's true. Yeah, maybe for that reason we should really quickly call the insurance company and get information, most up-to-date information. So now we would like to do a demonstration of how to check some blood pressures, and just randomly let's check how just to see, and this could be anybody. And of course, the best thing is to just sit down, relax for 5 minutes, and then we do it, right? Yes. Oh, nice.
Oh, that's uncrossed. Yeah. For the demonstration.
Yeah, just try to relax, nice. And actually, one more thing in terms of physical activity, as my physical therapy, oh, you can go ahead. As my physical therapy team discussed about the importance of body mechanics and ergonomics, it's interesting. Another medical group in California, I'm just gonna shoot the name, Kaiser Medical Center. They actually um, add another vital sign, and that is a question about exercise, because exercise is medicine. So they ask, how often do you exercise? How often do you exercise? And the recommendation for adults of all ages, general recommendation, is to at least walk 30 minutes every day, 5 days a week. And that will help you significantly, especially, with everything is calories, right? So the more calories we eat, the bigger we get, right? So we have to burn those calories. So we have to really exercise. And when we walk or when we jog, we use our bigger muscles of our body, our legs, our quads. So they will suck up the sugar. They will suck up all those extra calories, if you will. Yes.
Challenging. People think when we check the blood pressure, we make up a number. Well, I think you're right. Well, so we're not, we don't because, our vessels, there can be a difference, but it's not much. Like if somebody says, like, let me get my right arm and check the right arm. Because that's going to be more than normal reading. But you start comparing, sometimes there'll be a small difference. Then that's a whole nother discussion. Why is there so much change?
Sure.
So we can
Oh, sure. It's not working. So the main thing is to have the person that is being checked for the blood pressure to just sit down, best thing is for 5 minutes, and to use the appropriate cuff to check the pressure. Because if we get a huge cuff, then the blood pressure reading is going to be lower. If you use a small cuff, the blood pressure reading is going to be higher. So it has to be the right one to cover about 2/3 of the arm or so. And then you wrap around the cuff on the arm, and then you use your stethoscope and go ahead and place right on the artery, which is the brachial artery, which is right in this area. And really? Oh, I can take it if you don't mind. Now that I'm gonna get it right. Oh, it could be this. Do you want to use my stethoscope?
we won't tell you where we work. The official price.
I'm next in line. I can measure
Okay.
if you need me, but I'm recording. So.
You go ahead and look at the monitor. I don't want to turn around because she's taking it. And you start pumping. I usually pump it up to 200, and then slowly release the handle there. And you should not hear any sound. And once you hear a sound, like a boom, boom. So the first one, that's your systolic. And then you let it go all the way down. You're gonna keep hearing those beeps, boom, 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 until the last one. And that's your diastolic. And that's your blood pressure. There you go in the stethoscope. What was it? Yes. So according to the new guidelines, you have elevated blood pressure because the systolic is between 120 to 120. But it's not hypertension. Yes, sure.
ticks instead of listening for the sound, like just watching ticks? Like the helpful items.
They recommend that we hear. Yeah.
Some people it just happens to be.
Yeah.
All right. Well, thank you, Dr. Vasquez.
Sure.
Thank you to all of our presenters.
Yes,
And then there's another group coming in right after.
Oh, goodness, yes.